Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all to HeartWise Talks brought to you by Voice of Healthcare. In honor of World Heart Day 2024, we present our special series Heart Smart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with the vital knowledge about heart health. Our theme, Use Heart for Action, reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. And for today's episode, we have Dr. Subhash Chandra, Chairman of Interventional Cardiology and Structural Heart Diseases at BLK-Max Super Speciality Hospital, New Delhi. Dr. Chandra brings with him a wealth of experience, having performed over 25,000 complex angioplasties and more than 3,000 pacemakers implantations. His expertise spans coronary structural heart diseases and device implantations, making him a leader in fight against heart disease. It's a privilege to have you with us, Dr. Chandra, and welcome to our show.
Thank you, Simran. Let's start.
Yes. So for today's topic of the discussion is arrhythmias, heart attack, and cardiac arrest differences. So I would like to start by understanding what exactly is arrhythmias, which is normally misunderstood by general public. And could you explain us about it and what are the common symptoms people should look out for it?
Okay, Simran, thank you. Thanks for that humbling introduction. And at the outset, let me thank my audience on this World Heart Day, which is coming up in 29th of September. It is a very important day for us as fraternity in cardiology because it is celebrated across the globe, across several continents, societies, schools, colleges, and the whole endeavor is to propagate a message so as to keep the heart of people around the world healthy and prolong their life. Coming to your question about arrhythmias, you see the normal human heart beats at a rate of 70 per minute and it beats regularly. The heart rate could increase in the wake of exercise to 100 or 100 plus. But when the heart starts beating irregularly or starts beating very fast, and a person comes to be aware of his own heartbeat, that is what we call as a palpitation, and that has to do a lot with arrhythmias. So arrhythmias would arise either from two small chambers of heart, which is called as atria, or two large chambers of the heart, which are called ventricles. The atria, when they are contracting at a very fast rate in a regular fashion, it is called a sinus tachycardia. It could go up to 200 plus, and a person would be really very uncomfortable, can have dizziness or hypotension, or it could start beating irregularly when we call as an atrial fibrillation. The biggest challenge with atrial fibrillation, besides feeling uncomfortable because of fast heartbeat, is that when atria fibrillate, the blood tends to coagulate and stay in the atria. And when these clots are formed, they have a tendency to travel to a brain and can cause fatal stroke or paralysis. So that's the biggest fear of having atrial fibrillation, which is one of the commonest arrhythmia across the globe. After the age of 60 plus, almost 10% public suffers with atrial fibrillation. The two large chambers, which are ventricles, if they beat at fast rate, it would be called as ventricular tachycardia or ventricular fibrillation, and that is much more sinister and harmful because it can take life of patient. Most of sudden cardiac deaths are happening because of ventricular tachycardia or ventricular fibrillation under the realm of ongoing heart attack or otherwise because of myocardial issue. So this is the whole spectrum of arrhythmias, starting from atrial arrhythmia to ventricular arrhythmia, and one has to look out for the symptoms which I noted if you really want to be aware that you are suffering from some kind of arrhythmia.
Thank you, Dr. Chandra, for explaining that to us and to all our audience out there to have that basic understanding what exactly arrhythmias are. And when we come to diagnosing of arrhythmias, early is crucial for better outcomes. So, what are the most common ways to diagnose arrhythmias, and are there any advancements in detecting these heart rhythm disorders?
So, the first and foremost thing is the patient's symptom. Any patient complaining of palpitation has to be probed for underlying arrhythmias. And the methods could be starting from a simple ECG in an OPD to capturing it during 24 hours duration by implanting a holter or a recorder on his body, or doing an extended way to 7 days called as ELR or extended loop recorder, so as to capture those subtle arrhythmias which are happening without his awareness. But he would be lucky if he complains of palpitation, and on ECG we can see that some kind of arrhythmia is going on. The other methods in the modern times could be a lot of these gadgets or the smart watches, which can keep a track of your heart's rhythm, and they can easily diagnose atrial fibrillation, which I said at the outset are the most dangerous arrhythmias because they have potential to cause a stroke and paralysis in these patients. So atrial fibrillation can be captured on the intermittent ones, especially on the smart watches. So these are some of the ways and means to diagnose arrhythmia. If we are not able to diagnose them, then rarely we conduct some advanced electrophysiological studies in cath lab and try to relive or recapitulate that arrhythmia in the cath lab and then start searching for treatment of these arrhythmias. So these are various methods how one can detect it. So patients are always warned and advised that you should be very much aware about your own heart's rhythm. The moment you feel that you're missing some beats, you must come and visit a cardiologist and get yourself checked out.
Thank you for explaining that. And there's also some this thing that people do not understand the difference between the heart attack and cardiac arrest. So there's often confusion between it. So what could you clarify that difference between the two for our listeners?
So, Simran, that's the most important question you've asked so far. Because in general public, a general person would presume that a heart attack and the cardiac arrest are one and the same thing. No,
Hmm.
that's not the case. So heart attack would happen when a person has blocks in his coronary arteries, which are supplying blood to their heart. And once the block happens, then they start feeling severe chest pain. The chest pain is in behind the breastbone or in the jaws or radiating to your arms, coming on exertion or sometimes even sleep at rest. And you are alarmed that I'm suffering from something very sinister or serious. And when you get your ECG done, you see that the ECG is going haywire. It is clearly showing a heart attack going on. Your enzymes would be high, as in troponin. Your echocardiography would show that some parts of your heart are not moving properly because of lack of blood supply. So this is a classic heart attack.
Hmm.
Now, this ongoing heart attack can have various repercussions if you don't control it or don't report it in time or don't reach a hospital in time. That during the course of ongoing heart attack, you could have arrhythmia or the irregular rhythm of the heart. And this beat could lead to VT or a VF could lead to the arrest of the heart. The heart will stop functioning. So it comes to a standstill because the heart is fasting very fast, 350, 400, or it's not beating at all. And this is what we call as a cardiac arrest. So cardiac arrest is a much sinister emergency which can take your life, whereas heart attack is a warning, starting with chest pain, that you must immediately visit a hospital and get your artery cleaned so that you can survive. Unfortunately, almost 20% plus patients who suffer from heart attack at home to die on the way because of cardiac arrest. So it is mandatory that once you have chest pain of any kind, you must visit the closest hospital so as to exclude that you're not suffering from a very serious complication which can lead to the death. So I hope I'm clear between cardiac arrest and heart attack. Both are interlinked, but they both have very different repercussions.
Yes, you explained that to us in a very simple language so that every person out there can understand the difference. And you just explained us that even if, some people die on the way when they're going for to doctors while they're suffering heart attacks. So when it comes to heart attack, what are the most important warning sign people should be aware of, and how can they act quickly to prevent the severe damage?
So a heart attack starts suddenly, but let me tell you, it has been brewing up for last many years. So you may presume that you're a very healthy person. You have been walking around every day, and you have no issues. You have no angina. But because of various reasons, it could be underlying stress, or tobacco abuse, or smoking, or alcohol abuse, or eating junk food, or not exercising much. You never come to know that your underlying arteries have blocks. And one fine morning, this block bursts and it leads to total occlusion of the coronary artery. And the first time you come to know that you're suffering from a heart attack. It would manifest in the form of chest pain, as I explained, retrosternal chest pain going to jaw or neck or both the arms, and you have sweating or a lot of retching or unconsciousness, all of which or breathlessness could be a sign of ongoing heart attack. So heart attack is sudden, but the process of having a heart attack is very slow and brewing up for many years of unscrupulous or undisciplined lifestyle. So this is what we say. So we always advise people to be very active, be on the run always, walk regularly, run regularly. So that if you have any underlying blocks in your artery, you come to know about it in the form of angina, which is reversible. So let's say you've been walking 10 rounds in a ground. Now today at the fourth round, you start feeling tired or having chest pain. That is the sign that you have an underlying problem and you must see a doctor at the earliest. So you would be lucky if you have those symptoms of angina. So that's a wake-up call and you can visit doctor. But the most unfortunate part is that almost half of these patients never come to know that they have underlying heart problem and they land up for the first time with a heart attack. And the family would say that my husband, my brother was perfectly fine. How come it can happen to him? The problem is that he never exercised enough, he never strained his body enough so as to know that he suffers from angina or he has underlying blocks. Is that clear?
Yes, I think you pointed out very right thing that heart attack is something those in the undisciplined years of your life which you never exercised, you had a very bad lifestyle, eating habits and everything like that. And you pointed out very rightly that the amount of exercise should the kind of thing people say ki, okay, he used to exercise this much or something, but that was not enough. Something more or else or more disciplined lifestyle was required at that point
Correct.
of time. Yeah. So, but in case, like you just explained us this, cardiac arrest, like we are saying, it's a kind of life-threatening condition. So, in the event of cardiac arrest, what immediate steps should bystanders take before medical help arrives? Because most of the time, people are not aware, or the family members are not aware what to do now.
So, as you know, the cardiac arrest is a sudden event
Hmm.
and most unpredictable event. It could happen to a very healthy athlete on the ground. It could happen to a walking passenger on an airport who could collapse.
Yes.
It could happen to a shopper who's in a mall and could just faint and drop down dead. Therefore, the governments and societies have taken up this challenge that they have implanted the cardioverter defibrillators on most of these places which I've mentioned, be it an airport or a mall or in a public place, so that the moment you see a man who has fainted suddenly, you should have a training to pull out those pads, put it on the chest, give a shock, and you can revive that person. So, in society, we have been regularly conducting the educational programs whereby we educate general public as to how to resuscitate or revive a unconscious or a dying man. So, if a cardiac arrest happens, you see somebody fainting or dropping down dead on the ground, the instinctive reaction should be that if you have access to an AICD, you should pull out the pads, put it in the chest, give a shock, and there's a very high chance that you can revive that person. Besides this, the common steps of CPR could be giving him the artificial breathing, or with your thumb, with your wrist, doing a massage on his chest, or getting him to a quick hospital help could be the means and ways that you can save a lot of lives who are suffering from cardiac arrest in general public places. So that's the whole process.
Thank you so much, Dr. Chandra. You explained that to us in a very elaborative yet stepwise for us to understand and to act immediately in such situations. And I would like to thank you for giving us this time and spreading your expertise and experience with us in educating public out there for their heart health on this special occasion of World Heart Day, because it matters a lot. Your experience, your expertise is very important for us to spread awareness. So thank you so much for coming to our platform and sharing your knowledge.
Similar, with your permission, if I could end this program with final tips on the healthy heart lifestyle.
That would be
So
great.
a normal human being should be always be on run. So he should always be active. He should not be sitting or working from home in a chair for a long duration. He should be getting up every now and then and shuffle his feet. Make it a habit to exercise 30 to 45 minutes every day, be it in morning or late in the evening. It could be a cardio exercise like walking or running or jogging or cycling or swimming, in tandem with some weight training where you can strengthen your muscles with good protein intake, and of course, a little stretching in the form of yoga or respiratory exercise. This should become a part and parcel of your lifestyle. Number two, regarding your eating, you should try and avoid saturated fat in your meals, and those would be milk and milk products like deshi ghee, butter, and all deep fried items. Junk food or preserved food, which has a lot of saturated fat, should be avoided. If you're fond of non-vegetarian food, you should have fish or chicken or lean meat or white of egg. Try and avoid eating mutton with red meat. You should avoid all preserved foods like biscuits, cakes, bakeries, a lot of sweets. If you are fond of sweets, take a lot of vegetables and fruits in your diet, and take whole grain in your like millets and most of the grains mixed up. And that is the way to lead a perfect life. In the end, keep stress on the bottom of your agenda. So don't get stressed up with the fickle and little smaller situations in life. Be a strong man. If you regularly exercise, it is my challenge that you will grow up as a very strong individual and you can face any challenge, be it at your workplace or in your family or anywhere else. And family is the biggest life support in your life, which is not clearly visible. But let me tell you, people who are very successful are because their families behind them, their wives, their parents, their kids, their siblings, all of them pray for them, bless them, and that is how they're successful in life. So that's the key to a healthy life. And try and spread happiness and health to people around you. Thank you so much.
Thank you so much, Dr. Chandra. You summed up the complete episode and this awareness message in a very, very well. And thanks a lot for this. Thank you for coming to our platform.
Thank you, Simran. You conducted very well. Thank you.
Thank you.
Bye bye. And happy Heart Day.